ahead and get started with introductions. So hello, everybody, and welcome. My name is Laurel Glenn, and I, along with Aram, who you will also see during this webinar, we work with Safety, which is a grant funding research to maximize the potential safety benefits of disruptive technologies addressing transportation safety questions today. So we appreciate you joining the webinar on autonomous vehicles for small towns, which is our topic today. Right now, you've all come to the meeting muted, and I would like it if you appreciate it if you all stay muted until the question and answer session. Captions will be on for your convenience. The videos are going to remain off just to preserve the bandwidth strength for this webinar. But if you have any questions during the webinar, feel free to go ahead and put those questions in the chat box. We will be monitoring that as the webinar progresses. And then also any kind of information that you might want to stick in as well. You can go ahead and share that at that time through the webinar or through the chat box. At this time, I would like to introduce the moderator for today's presentation, Dr. Marcia Ori from Texas A&M University. She is a Regents and Distinguished Professor, Department of Environmental and Occupational Health. Her primary goal is to reframe healthy aging as the new normal through innovative research, education, and service. She has been a core member of the Endeavoride Safety Project, which is what funded this research that you're going to hear today, examining community perspectives on the feasibility and usability of autonomous vehicles. She will be serving as a moderator for this webinar today. So again, you can use a chat box throughout the webinar, and we will address questions at the end. Now I'm going to go ahead and turn it over to her.
Thank you so much. We're all delighted to have this opportunity to share our work. Let me first introduce you to our team. And you can see on this slide, we have broad partnerships. They span academia, community, corporate sectors. So you can see at the bottom, I'd like to call out to Texas A&M University, Wocsor, Endeavor, Texas Transportation Institute. Now let's go to the next slide to look at our particular team members. So you've already introduced me. Our first speaker is going to be Mohammed Usman. He's a doctoral candidate in urban and regional science here at Texas A&M. He's been working with the Endeavoride program for about 5 years. And this is a great example of not only research to practice, but how research and education can also be intertwined. And this project is part of his dissertation research. Next up, we have Dr. Wei Li. He's an associate professor of urban planning, again, at Texas A&M University. His passion is research, education, and service activities that lead to smart solutions for challenges faced by underserved communities and underprivileged populations. What you need to know about Dr. Lee, he's an inspirational social entrepreneur. In 2020, he founded the Endeavor Institute. This is a 501c public charity. It's dedicated to bringing smart city technologies to small communities and underprivileged populations. And we'll be hearing about some of the aspects of this program today. And then there's Kevin Roscom. He's a systems engineer who started his own business, that's Wocsor, in 2020. And this is a startup company to convert regular vehicles into autonomous vehicles and thus make AV technology both accessible and affordable to everyone. And since 2017, he's been a significant contributor to OpenPilot. This is an open source ADAS system that's been tested for 90 million miles. And then lastly, we have Bahar Dadashova. She's a mechanical engineer by training. She's a research scientist at Texas Transportation Institute for almost 10 years. And her research is heavily focused on transportation safety. She provides a framework for looking at safety issues, and she's the principal contact for our safety project. So let's go to the next slide, which talks about the topics we'll be covering today. First of all, we'll be having some research from a survey on perceptions of AVs in small towns. And then we're going to be talking actually about the deployment of AVs in small towns. And this is through Endeavor Ride. There's going to be two different perspectives. First, what AVs look like on the ground and the services they can provide. And then secondly, how to design them. And then we're going to end up with safety implications of AVs. And as we said before, we want to leave plenty of time to have audience feedback and questions. So let's go ahead to the next slide for our first speaker. And let me just say that Mohammed is going to get his degree within the next year. So we are so proud that he's going to be part of a future generation of researchers and planners in this area. Mohammed, we look forward to hearing your talk.
Thank you, Dr. Marcia. Hi, everyone. This is Mohammed. I hope everyone can hear me. In the next few slides, I'll be explaining my research, that is perception of AVs in small towns in Texas. Next slide, please. Next slide. So as we all know that the autonomous vehicles have gained momentum over the past few years, and there are many benefits that are associated with the use of autonomous vehicles, such as reduced traffic congestion, less traffic accidents, efficient means of travel. At the same time, it is really important to understand how people think about autonomous vehicles and what are their perceptions about such vehicles. However, most of the perception research, existing perception research is restricted to large cities and metropolitan areas, and small and rural communities are overlooked in this regard. We believe that autonomous vehicles can play a really important role in alleviating transportation barriers in small and rural communities. Next slide, please. So with this brief introduction, my research question is how residents of small and rural communities perceive AVs and their societal impacts, and what are the socio-demographic characteristics that influence these perceptions. Next slide, please. So for this study, we selected 12 small and rural communities in central Texas. All these communities have a population less than 50,000 people, and they showed great interest in autonomous vehicles through community engagement through our Endeavor program. We used United States USPS every door direct mail services for distribution of flyers, and Maptionary and Qualtrics platform were used to record responses from the participants. People had the option of filling out paper survey as well, and mailing it back to us. Next slide, please. So the questions that we asked people, they were based on existing research, and those were the same questions that were used by Shuttle and Civac and Pew Research Center to gauge perceptions at a national level. And the purpose of using the same questions were that we wanted to compare how respondents from smaller rural towns, their perceptions compared to the ones from the people from the national studies. So our questionnaire, it had 5 parts and a total of 65 questions, but this research is concerned with the driverless vehicles part and the demographics. A total of 1,153 responses were included in the final analysis, and summary statistics and ordered logistic regression models were estimated to gauge the association between demographics and autonomous vehicle societal impacts. Next slide, please. So this screen shows the general awareness and perception questions that were used in our survey. We also asked about the enthusiasm level and worry level from the participants, just to see how they compare with the national sample. Next slide, please. So these 20 questions, they are the potential impacts of autonomous vehicles that are commonly found in the literature. Some of them include decrease in congestion, increase in trips, older people and people living with disabilities would be able to live more independently, parking lots not required, and roads would be safe for pedestrians and bicyclists. Next slide, please. And these are the few regulations related to autonomous vehicles, like they requiring them to travel in dedicated lanes, presence of human driver and a human assistant to serve people with disabilities. Next slide, please. Now coming over to the distribution of our respondents, our sample was generally balanced with the slightly more number of males, and the distribution of age group as most of the respondents were middle-aged, from 25 years to 44 years. Next slide, please. Again, about 3/4 of the respondents were married or living with partner. Next slide, please. So in this slide, it shows the household income distribution and the educational attainment distribution. It is seen that about 40% of our respondents had annual household income from $50,000 to $100,000, and about 1/3 of our respondents had at least a bachelor's degree. Next slide, please. So coming over to the knowledge and perception questions of AVs, we can see that about 68% of people had at least a little knowledge about AVs, and more than 40% had a positive view of autonomous vehicle, especially in the context of small and rural towns. Next slide. This slide shows that about 76% of people had at least a little level of enthusiasm in autonomous vehicle, whereas 65% showed some worry about autonomous vehicles. Next slide, please. So the distribution of males and females and age group, we can see mostly males are more enthusiastic about autonomous vehicles, and it can be seen that in the age distribution graph, it is important and interesting to note that this people with 65 years of age or more, they are really enthusiastic about autonomous vehicles. So this is the comparison with the national study of the perception questions. It is really important to know that people in small towns, they are enthusiastic about autonomous vehicles as compared to people in the national level study. Like in our survey, about 3/4 of respondents show enthusiasm, whereas only 40% showed enthusiasm in the national study. Also, more than 80% of respondents in our sample, they think that autonomous vehicles would be there in the next 50 years as compared to 65% in the national level study. Next slide, please. These are the AV impact questions and the responses. You can see a majority of the people think that older people and people with disabilities would be able to live more independently with autonomous vehicle. 50% of people believe that there would be less congestion. Interestingly, only 43% believe that parking lots, there would be less requirement of parking lots, and also only 32% think that roads would be safer for bicyclists and pedestrians. Majority of the respondents, they favor the regulations related to autonomous vehicles like human assistant and dedicated lanes. Next slide. So this is the AV impact comparison from our study and with the national level. Most of the results are generally comparable, but it is important to see the difference in traffic congestion, where 50% think that, in our sample, think that there would be less traffic congestion as compared to only 28% people in the national level survey. And also, the rest of the results are generally comparable. Next slide, please. So these are the demographic association with AV impacts. It can be seen that gender is associated with 15 of the AV impact questions, followed by employment status, household income, marital status, age, and educational attainment. So males are generally favored generally are likely to agree with the impacts of autonomous vehicles, so on, and employment, and people who are employed also favor are likely to believe that these impacts are likely to happen. Next slide, please. Now that we know that people in small rural towns, they are enthusiastic about autonomous vehicles, and they really believe that such vehicles would be there in the next 50 years or so. So we need to formulate inclusive transportation plans to accommodate future growth of these areas. We also know that people have been moving to small and rural towns from large towns during the past few years because of their flexible work schedules. Inclusive transportation plans would be the way forward. Also, autonomous vehicle pilot programs, including a transit service, should be explored. This service can either be on fixed route or dynamic route, but this can really help the transportation issues that are there in the small and rural towns. Also, we know that there are some anti-AV sentiments out there, so it is important to spread awareness and education to counter these perceptions, especially as you know that these vehicles can really help people with disabilities and older people. In the end, I would say, like to say that AVs, they offer an affordable, safe and efficient mode of transportation, and they present an equitable solution to all the transportation issues, especially in small and rural towns that are there. Thank you.
Thank you so much for that really excellent overview of people's perceptions of AV. Now we're going to go to our second speaker, and this is Wei Li, and he's really the brains, the heart behind the Endeavor Ride initiative. This is the whole concept of empowering communities to address transportation issues. And I think as we hear him speak, what you're going to hear is the passion that he brings to this effort. Wei?
Yes, next slide, please. Yes, so many people have chosen to move to small towns since the COVID-19 pandemic. The remote work options give people the flexibility to live and work from anywhere. And small towns have a lower cost of living and more housing and more outdoor space. It's becoming very popular, and people are moving to small towns to live and work. And this is a tremendous market for the mobility and tech industry to explore. You know, if you guess, well, you cannot guess anymore because you see the numbers here. So in the US, there are 18,696 small towns, defined as towns with a population of less than 50,000 people. And these towns are home to 80 million people. 80 million people, more than 18,000 small towns. It is a tremendous market. Since 2016, I have been working passionately with colleagues at Texas A&M University and the industry to empower small towns with emerging technologies. As Dr. Marcia already mentioned, Endeavor Institute is a 501c3 nonprofit organization that aims to introduce these technologies to small, underserved populations and communities. It is a great honor today to share one of our stories. Next slide, please. In November 2020, we retrofitted a minivan to run Open Pilot. It is an open source, market-ready ADAS system. It is based in Nolanville. It is a small town in Central Texas. It is home to 5,000 people. We call this program Endeavor Ride. It is a combination of transport and telemedicine. A user can request a ride for their daily transportation or request a telemedicine service. Once you request a service, the van will arrive at your home to deliver either of the service. Next slide. The Endeavor Ride has achieved tremendous success in the past 3 years, 2.5 years. So people love these innovative programs. We focus on serving the most vulnerable populations, such as people with disabilities and older adults. I'm very, very proud to say it is 100% funded and operated locally with support from the community, volunteers, and private donors. Next slide. So as I mentioned, it is a combination of transport and telemedicine service. Here, what you see is a tailgate clinic. So people can see a doctor remotely in this space. Next slide. And right before the second row of the van, we also have a station for video conferencing. So there are two options. People can see the doctor inside the van or at the tailgate area. Next slide. Here you see the equipments that we have installed in the van. These are vital signs. They can measure vital signs and measure height and weight. These are important information for doctors to know. Next slide. We also have a remote diagnostic devices, which can help doctors to gather essential information from the patient during the visit. Next slide. So how can a user request for service? We have an app which a user can use to request either transport or telemedicine service. But we understand that not everybody is comfortable about using smartphones and apps. So we also offer options of phone calls and text messages. Next slide. We would like to learn about how people are using the service. What are the places they visit? So we carried out the trip counting studies in 2021, 2022, and we're very grateful that we have Mr. Wesley Sprout, who graduated from the Master of Urban Planning program at Texas A&M University. He developed his master's paper based upon the Endeavor Ride program. And this is a map that Mr. Sprout produced. As you can see, this is the boundary of Nolanville, and the grids you see are the home locations of our users. They are mostly live in north part of the Nolanville, and these are places where more affordable housing opportunities are located, such as trailer parks and apartment complexes. Next slide. Most trips are located in a neighboring town called Harker Heights, but trips can go as far as 20 miles from the Nolanville City Hall. Next slide. And this map shows the major destinations that our users have visited through our service. And these destinations, as you can see, can provide essential services such as food, water, clothing, and medical services. Next slide. On a monthly basis, this program provides about 100 trips to older adults and people with disabilities. And imagine that it is based upon the support of volunteers. And myself is one of the volunteers. So Mohammed is also as a volunteer safety operator. So we're very proud that we work together with the community to deliver the services. Next slide. We have carried out a series of focus group studies. We carried out these studies in order to gather data from our actual users. Our research aims to gather feedback from the users so that we can improve the program in Nolanville and also create similar programs in other small towns. Next slide. So this is one of the focus group interviews. You see myself and Dr. Marcia is there as the best facilitator in the world for the interview for the focus group. And the audience you see in this focus group are our actual users. It is a community-based program. It has exciting, innovative components featuring autonomous driving technologies and telemedicine. These are not something that our users get exposed to before the studies. So people have, trying to wrap their heads around the new technologies and new services. Some users had fears about autonomous vehicles, and their fears may come from a negative media coverage. But when they tell us, when they actually see how it works, sit inside, when they see the steering wheel turning and how it works, the fear melted away. Next slide. So we learned that our users before the Endeavor Ride service, they would ask for their family members or church friends to give them a ride. It worked, but people may feel a burden. They got causing a burden to their family, and these were limiting some of the opportunity for them to create it for themselves. And we are very, very pleased to see that Endeavor Rides will help the users to reduce the hesitance and unleash more needs for travel and beyond. And In order to find out more, in addition to the focus group studies, we also give our users, we use the data, GPS data, to track how many places more they visit through the studies. And in the next slide, you can see, next slide, please. Yes, in this next slide, it shows the travel locations of our residents through our program and their daily travel as well. We're very pleased to find that through this program, and on average, a user will have 8% higher POI, or point of interest visit, because of this program. As I mentioned, that it is a community-based programs. It is owned by the community, operated by community volunteers. So throughout the operation of the program, we have very closely engaged our stakeholders and communities. So we want to show that what this vehicle is capable of achieving, and what it is a tremendous potential to use these new technologies. Next slide. And it is also an exciting educational instrument for kids living in the communities. Middle school kids, high school kids, they come and join the open house events and other community events. You can really see their eyes shining when they are sitting inside a vehicle using a joystick control, like an Xbox joystick control, and they are able to see that they will be able to turn the steering wheels, apply the brake, and hear the engine revving using that control. And we show them this is how the autonomous vehicle work at the bottom. And it's very, very precious to see the kids and other residents in the community respond positively to the tremendous potential. Next. So as we believe the philosophy of a lead by example. If we want to show that we can solve the mobility problem for small and underserved communities using autonomous vehicles, we're going to do it. So myself as a volunteer safety operator, Mohammed, and many other volunteers, we work together to deliver the service. Next slide, please. And this is one of our volunteers, and we have a little video clip to play here. Not sure we can play in here. It doesn't matter if you cannot play, we can, no worries. So she has been working very passionately to support this program. During the COVID-19 pandemic, she delivered many rides to people so that people can get their COVID vaccination taken care of properly. People can see and receive a COVID test. And it has generated very, very positive vibe in the community. Next slide. The Endeavor Ride, the Endeavor Institute has trained more than 200 students, college students from Texas A&M. They come from 10 different majors, and they serve as volunteers and bring a lot of aspiration into the community. Next slide. So we have received the Kellogg Award for exemplary community engagement. After that award, I became very loyal to the Kellogg cereal brands. Next slide. So currently, because of the success of Endeavor Ride program, the local transit agency has decided to give a donation to us. So we have received a 12 passenger bus. So what the plan is to add the autonomous driving technology to this bus, and we are going to aim a level 4 fully autonomous operation. Next slide. So, and this is the map that shows our vision for the next 5 years. We plan to deploy level 4 autonomous driving in the community through 3 different phases, so that we can connect the residents in Nolanville to the essential destinations, to the bus transit centers, and to the places that they would like to visit but were not able to visit before because of lack of public transportation. And we believe that this is a very exciting future, and we are all in this together. Endeavor is creating values. We're very thankful to the support of industry, and Wocsor LLC, Mr. Kevin Roscom, made very generous donation to the technology to us, and we're going to hear from him in the next few slides.
Thank you so much, Wei, for letting us visualize what it's like to actually have AVs in a small community. So next we are going to hear from our corporate partner, Kevin. And I think what's exciting is we feel so lucky to have somebody on our team who understands the actual technology. And I feel lucky because I've actually ridden in one of the cars that he's redesigned, not on a small town street, but in a mountainous area. So Kevin, please let people understand through your talk what it's like to convert a regular automobile to a AV. So Kevin, you're on now for your talk.
Thank you for that kind introduction, Dr. Ori. So before you can actually get to retrofitting a car, you have to understand the SAE 5 levels of autonomy, right? So it ranges from level 0 to level 5. And basically at level 0, you have every car made before, we'll say the year 2000, when the industry really started to develop adaptive driving technologies. And then at level 1, you've got feed off. And with this, we're talking about adaptive cruise control, which is, distance following cruise control with usually radar guidance, sometimes LiDAR. And then at level 2, you have partial automation, which is where every available technology you can buy, including OpenPilot, which our system is based off of, and Tesla Autopilot as well. You've got Super Cruise from GM is in here too, and that kind of actually bleeds into level 3 a little bit. Same for Tesla Autopilot, but basically level 3 is highly automated. That's where you might have lane keep assist and adaptive cruise control, lane centering technology available without driver monitoring within select situations. So with Super Cruise, that's on the highway, as well for Tesla Autopilot. And I believe some experimental modes of OpenPilot are also around this area. And then level 4, you have mind off, fully automated. And this is where the car starts to drive more like a person would. This is basically, I like to say, this is where it becomes from a teenage driver to an adult driver. And you can actually, potentially sleep behind the wheel. There are certain situations where the car may want you to intervene. So there's still going to be controls for the human. And then at level 5, you have full autonomy, which is superhuman driving. Basically, you can almost guarantee that the car will not crash into anything and will not require human intervention. The car may be able to pull itself over if it detects a fault. Stuff like that. You may not even need a steering wheel or driver's seat even. It could be multiple bench seats. Next slide. So right now where we're at is level 2. So we still require a safety driver to actually engage the system and disengage the system, as well as take over if there are any mistakes. This level basically just assists them and makes their job a lot easier. Next slide. Long term, we would like to get to level 5, and this is where everyone's really trying to shoot for, via digital infrastructure such as Tag My Town, which we'll talk about in a bit, and high definition maps. These technologies allow the car to actually better understand its location and other environmental factors. Next slide. So we iterated a few times over the past couple of years engaging with this project. So for version 1, we actually had to modify the vehicle pretty significantly. We had to retrofit a motor into the steering column. We actually required welding. We had to have a mechanic help out. And there was a heavy compute requirement as well, because we wanted to essentially chase what you see in academia with with big models that actually try to understand and look at every single factor and label it. And that costs a lot of compute. Next slide. So here's basically a piece of what was installed. Over the next few slides, we'll see basically the requirements to get to the level 1 system that we built, as well as all of the modifications that needed to be done. And here you can see the compute, which is actually a workstation class PC. This is like a 600 watt computer. Really doesn't sip on power, more like guzzles it. Next slide. And then here you can see we're at a local mechanic shop in College Station, actually doing the retrofit of the actuators. We actually needed their help to be able to do this because just the installation was so complex. We needed an ASC certified mechanic. And there were, as you can see, all these wires here, lots and lots of testing and lots of design work that went behind this. Next slide. And this is basically a demo of the system working. So you can see the steering wheel turn here by itself. And because we actually modified the car significantly, this system actually had full access to everything in the car. So it was able to turn the wheel via 1 horsepower motor, which we definitely needed to work very diligently building the safety for that. So next slide. So for version 2, we actually changed the braking system from a Toyota Prius actuator, which had to be modified. Basically, the analog signals needed to be replicated for that system to work. So we changed that out for a Tesla iBooster, which is a lot sleeker. It was a bolt-in modification and it's recycled parts. As well, we got a radar from the Toyota Safety Sense 2.0 system, which is on modern Toyotas, starting with the 2019 Corolla hatchback and RAV4. We also use a 3D printed steering actuator, which allows us to use a smaller, safer motor, as well as it is affordable because, a roll of 3D printing material is like $20. And it has the benefit of being completely reversible. So we can always go back to the stock system if we want to. And we released all of the designs for this open source. So all of this is available to replicate. Next slide, please. And here's actually a picture of inside the cockpit from the with the level 2 system, and you can see the steering actuator there on the column. So that's a lot smaller of a motor, and it's shrinking. So this is also getting better. We have 2 compute units. Primarily, we use a cell phone running OpenPilot, which we essentially hack into with computer B. And that actually does the GPS and traffic control system. So, identifying other cars in the intersection and knowing when the light is red, stuff like that. Next slide. So Tag My Town, we alluded to this a little bit, but basically you want to collect a bunch of data. And there's a couple of different ways you can do that. With Tag My Town, we distribute the load of making what's called a segnet. So basically you have people taking images from each drive and you label, drivable surfaces, the lane you're in, non-drivable surfaces, and objects in the road. So what we wanted to do was democratize this process so that people would be more familiar with how the system works, the nuts and bolts of it, and as well as that, essentially pre-planning the path. So Tag My Town would be essentially a great way to aggregate that data locally and Therefore, it should drive a little bit more like a person in that locality would. So the car shouldn't interfere, essentially like transplanting a California driver to Texas. You wouldn't have any situations where the nuances would be different, hopefully. So yeah, and hopefully in the future, this can be used to make the level 5 system and have it highly localized. So
Thank you
for
so
having me.
much, Kevin. I think we're going to need to move on. And so our very last speaker is Bahar Dadashova, and her whole expertise is around safety. And I think this is so important to have people feel comfortable to understand a framework for safety. So Bahar, can you do your presentation now, please?
Yeah, sure. Next slide. Try to be quick. So this is just a map of locations where we were trying to see how the AVs may potentially impact safety outcomes. In rural towns, assessing the safety outcomes of AVs is a little challenging because the acceptance or the AV acceptance is very important in order to estimate the demand. And as we saw from Usman's presentation, it can be affected by demographics and people's safety perceptions, as I will explain in the next slide. I was still in the first slide. Sorry, can you go back? Yeah. So one of the things we saw in Usman's presentation was that people's acceptance of AVs or AV use may be impacted by the gender or the employment, which is a bit different from the previous studies where we usually estimate the demand based on the household income. But the household income here in this case is not that is not as significant as the perception by demographics. And crash characteristics can also be different in rural town, which is one of the factors we usually take into account for AV safety assessment. And that will eventually affect the impact areas and scenarios that AVs can can be helpful to prevent some of the crashes. Next slide. So here's the framework that we had used in one of our previous studies. This was also a safety project where we're trying to explore the impact of AVs using the one of the safety assessment methods. I will explain it later. What are the methods used for safety assessment? But in this framework that we developed, we normally start with the exposure and estimate the demand. And then the next step is to look at the crash characteristics that will be helpful to the exploration of crash characteristics can help us to understand what AV functions can help prevent those crashes. And this is, as you can see in this graph, can be different for level 1 and 2 automation and levels 3, 4, and 5 automation. And then to estimate the final safety effects, we also have to take into account the failure risk, like sensor malfunction or ADAS effectiveness, while in levels 3, 4, and 5, we also have to look at the disengagement risk. Next slide. So as I explained, for the exposure, in order to estimate the exposure, we have to look at the acceptance and socioeconomic and demographic factors. As we saw previously in rural towns, this can be different contributors of crashes, can be the driver behavior, roadway infrastructure, and vehicle. If you have worked with safety, you know these are the 3 main factors. But in addition to that, driver behavior is something we had taken into account previously, but as we also see, the characteristics of the driver and demographics is also an important factor. The next thing we have to take into account is the type of crash and who gets involved in crashes, like whether it's a pedestrian, bicyclist, or fixed object. In rural town, we don't have a lot of exposure, so this can be, again, in the context of rural towns, this effect can be different. And also we have to look at the location of the crash, where the crashes happen, because as we know, the AV's functionalities can change, because most of the level 2, they can operate on freeways, but when it comes to intersection or local roads, navigating through those may be challenging. Next slide. So for the exposure, we also looked at this can be affected by both the perception and acceptance of AVs, but also people's general perception of how they perceive the safety at different locations. For example, people from our survey result, we saw that people don't feel comfortable driving through higher traffic volumes, or they are wary of aggressive drivers, or they are not really comfortable, especially in rural town, driving through intersections. And hopefully AVs can help to alleviate some of these factors, so the exposure or estimated exposure can be very different than what we expect, what we usually see with the conventional vehicles. Next slide. So and also, as I said, crash, like the reason why we're looking at the crash characteristics, and then comparing it to AVs, we know that different crash characteristics can be affected by the ADAS functionality of the vehicle. Here, I'm just putting example of, for example, AC, adaptive cruise control, the one that Kevin mentioned. This usually controls the acceleration or braking of the vehicle automatically. And we assume that this can help to remove the driver errors like distraction or false assumption of others' action or misjudgment of the gap acceptance. We also assume that this can help to remove or decrease the number of rear-end crashes and involving vehicles only. And the location where this system is helpful or useful are the freeways and arterials. But this system also has 1 to 4% system failure risk. Next slide. Oh, that was okay. So as you can see, the challenges, there are different challenges with estimating the safety effects of AVs in rural areas. It's very different from the normal studies where we have conducted surveys and studies to assess the safety effects of AVs. Normally, what we have seen in the studies that they use target crash population or traffic simulations. We have a study on this showing how the safety effectiveness have been evaluated normally, but all of these assumptions change when we come to rural town, because they are affected, first of all, starting from the exposure. It can be affected by the exposure, the demand for the AVs, and that demand in turn can be affected by how people perceive and accept this. But so far, the changes or these perceptions are not really significant for us to make any implications or any assumptions. So we don't expect to see significant effect on safety. That's why we have to go beyond safety, not just the crashes. I think, especially in rural towns, it's very important to look at other health impacts of AVs as well, like this project is doing. Next slide.
So thank you so much. I think that's really important for people to understand safety issues and research that we still need to do. So we're sort of at the end of our time, and what we should do is go to somebody who's patiently been waiting for a question. And this goes back to one of our earlier talks. And this is for Wei or anybody who would like to answer it. What are the methods you use to manage transportation data privacy? So any of the panelists, you first, Wei, talk about data privacy, please.
Yes, so data privacy is a very important issue for autonomous driving. It is very important to the users because it is one of their biggest concerns. So for this case, our pilot program has been following a two-step basically procedure. Step number one is about data related to medical information, because we also deliver the telemedicine service. So we have followed the protocol as suggested by the HIPAA. We need to make sure that our platform is HIPAA compliance. We have an agreement with the Google by using the Google products to satisfy that. So that part, and of course, our staff members have gone through, very vigorous training to make sure that everybody will follow that protocol. In terms of the data that is generated by the vehicle and autonomous driving system, I will let Kevin to cover this question in more details.
Hi.
Kevin?
Yep. Sorry. Could you ask that again? Part of it.
Well, this is all about data privacy, and now you know where cars are going, and so people are concerned, I think, always about privacy if people can track them. So how do you say that autonomous driving will be able to protect privacy of what people are doing and where they're going?
So for our system, it's actually two different things. So one is it's an opt-in. So we also, because we also can get data from regular users on the ground, and we can pull in data from there. The ability to pull in data and whether or not the user actually opts in to share their data with us, it's dependent on that. And then second, once they do opt in, we anonymize that data. So we cut parts of their drive for, basically the first few minutes, the end, and then we have some controls in place so that we don't know whose data we're looking at when we train our model, and just other things that are pretty standard for the industry. But yeah, so we don't know who. It's almost like a double blind situation.
Excellent. Thank you so much. Let's sort of ask a futuristic question. What do you see as the future of AVs in small towns? And anybody can sort of jump in way. I know you're going to have a long-winded answer, so we'll let you have the last response. But what is the future of AVs, not across America, but in rural and small town America? Who on the panel would like to address that question?
I would just offer a few comments, and then we can have other members to join. I believe let's first look at a small town, the transportation challenges. So small towns typically have one thing in common. They do not have a very functioning public transportation system. That was due to many factors. Our cities have built this way in the past 50, 60 years. So this is a big problem. And a small town has another problem, that is the aging problem. There are many populations are getting older, and many of them move to small towns. And at some point, they do not feel comfortable about driving. So when you put these two things together, very naturally, AV should be the solution. It has the solution. It has the potential to empower these vulnerable populations with independence. It has the potential to operate the future public transportation in small towns more efficiently. Because not only by cutting the cost of the driver, but also by making the system safer. So I'm very optimistic about building autonomous driving systems and public transportation system empowered by autonomous driving for small towns. There are more than 18,000 small towns in the US, home to more than 80 million people. It is a tremendous market for the AV industry to explore. And the Endeavor Institute would like to become the bridge to create values for the industry and create the power to empower these communities with independence.
Excellent. Thank you so much. We want to make sure we give the audience a time to ask any questions. I don't see any, but if there are any questions, either raise your hand or even better than that, type it into chat. So we want—
Is our chat disabled? I look like
no, there's chat still working, I think. But if there are any questions, please put them in. But the next thing, and maybe the chat that I'm seeing is only through the organizers, but I did see somebody come in. But let me just, if we don't see anything, here's what I'd like to ask the panelists. And Mohammed, we're going to start with you. In 10 to 20 seconds, what is the take-home message you want people in this audience to know from your work, from your study?
Thank you, Dr. Marcia. So I think small towns, they are really overlooked when it comes to transportation justice, and people, they really have transportation difficulties, whether they are sensory disabilities or physical disabilities, and people with old age. Small towns, they have diverse outlook, all sorts of household income households are there. So I think autonomous vehicles can really help alleviate transportation mobility, especially in small and rural towns. And I think people in our sample, people are really enthusiastic about it, and they believe that this system would work in their areas.
Excellent. Kevin, 10 seconds. What message do you want people to know?
AVs don't have to be expensive, right? So if you approach one of these AV companies to try to do a demo or something, and they say you can't afford it, just keep trying, because it's possible, clearly.
That's an excellent message. Bahar, from a safety or other perspective, a TTI perspective, what's your take-home message?
I think we have to go beyond just looking at the safety in numbers, like crashes. So I think in terms of AVs and the services it can offer, like potential it has, it goes just beyond, and just numbers aren't really helpful. Yeah.
Excellent. And we heard from Wei, so let's go back to Laurel, who wants to close it out. But I just want to thank everybody. This is such an important topic, and you can just see and hear the passion of our team members. So Laurel, back to you for a close-up.
All right, well, thank you everyone again for joining the webinar. And as many of you already know, this webinar will be uploaded onto YouTube, and I'm going to send out an email to everyone when that video is uploaded, as well as when the slides will also be uploaded, and I'll send links out to that. And then also registration is open for our next webinar. I already went ahead and put the registration link in the chat if you want to go there and register. It's going to be on the evaluation of the Safe Routes to School program in San Diego County with Dr. Gabriela Fernandez from San Diego State University. It is scheduled for June 9th at 2 p.m. Eastern Standard Time, so the same time as this webinar. And you can register either on the safety website or via the link that I dropped into the box. So thank you guys very much. If anyone has any further questions, they can hang around. Otherwise, I am going to say goodbye. Thank you for joining.